A new FDA-approved device being called the Safer Pacemaker is now making it possible for patients with pacemakers to receive MRI scans. For people with a traditional pacemaker, MRIs are off limits. An MRI's magnetic fields can disrupt a pacemaker's electronic system and even burn heart tissue. Medtronic estimates that each year, 200,000 patients with traditional pacemakers forego MRI scans because of those risks. The specialists at the Center for Medical Imaging explain how MRIs tend to benefit those 65 and older the most because the scan offers the clearest picture of various cancers and brain disorders.
MRI exams, I feel, are a great advance that has come about in the last 20 years since I've started practicing. MR exam is different from X-rays. There is no radiation. A person sits inside a magnet, and it's a very strong magnetic field, and actually the person's body water gets magnetized. And because of the advances in computers and magnets, we're able to get images just using magnetism. It is extremely safe, and it gives us information that we can't get from any other type of exam. We can do MRI exams for musculoskeletal, whether it be injuries, tumors. We can do it for back pain, neck pain, MRIs of the brain. The major advantage of MR compared to CAT scan, which used to be the gold standard, is that we have much greater soft tissue contrast. We also have an ability to actually see not just anatomy, but imaging based upon function. And that's something that it's absolutely amazing.
Imaging kind of lays the foundation down for the diagnosis of many diseases nowadays. There are many diseases that are first picked up by imaging. And so by having good quality equipment, it helps facilitate the diagnosis of diseases at an earlier time. The best thing about MRI nowadays is that we have much better equipment that gives us much better images, and also makes it easier for the patient to be imaged. We have a larger bore now, and it's shorter in length, so patients don't quite feel as closed in as they used to be. I don't know if you've ever had an MRI done, especially years ago. There were very long, small tunnels, and you were in there for quite a while, and they would heat up, and it's very uncomfortable. It's disconcerting. Nowadays, the bore is so much larger, it feels vacuous in there nowadays.
The MRI Safe Pacemaker doesn't cost patients any more than a traditional pacemaker and is generally covered by insurance. For more information on the numerous imaging procedures available at CMI, please click the MRI Safe Pacemaker story link on our homepage, yourhometownhealth.com.